If someone reads the label, nuts look like a trap. Tiny handful, huge calories, mostly fat. Yet health advice keeps putting them in cardioprotective diets. Is the nut story basically healthy but don't eat too many? Or is there a real body mechanism that makes the calorie label incomplete?
That is the right tension. Nuts are not magic negative calorie foods. They are concentrated energy. But they deliver that energy in a package rich in unsaturated fats, plant protein, fiber, and micronutrients. Chewing does not fully break every cell wall, so some fat is absorbed slowly or incompletely. More importantly, nuts often replace chips, cookies, processed meats, or refined snacks. So the real comparison is not nuts versus air. It is nuts versus the food they displace. After a nut meal, fat is emulsified with bile and absorbed as fatty acids, but the profile matters. Walnuts, almonds, pistachios, cashews, peanuts, and Brazil nuts differ, yet most skew toward unsaturated fats rather than saturated fats. Those fats enter lipoprotein traffic, cell membranes, and vascular signaling. Fiber reaches the colon, where fermentation products may support gut function. Protein adds satiety. That combination is why calorie density alone is a blunt instrument.
When videos say nuts help the heart, people hear, "My blood pressure will drop." What did the walnut trials actually find? Are we talking about a clinically obvious change or mostly subtle vascular markers?
A 2026 systematic review of 36 randomized walnut trials found no statistically significant overall reduction in systolic or diastolic blood pressure. The average systolic estimate was about minus 0.65 millimeters of mercury, with confidence intervals crossing zero. But walnuts did significantly improve flow-mediated dilation by about 0.93%, a marker of endothelial function. Longer studies, at least 12 weeks, suggested diastolic pressure may improve. So the honest message is vascular support, not a guaranteed pressure drop.
Flow-mediated dilation sounds technical. What is the artery actually doing there? And why would a food with fat in it make the vessel lining behave better instead of worse?
The endothelium is the inner lining of blood vessels. It senses shear stress from blood flow and helps release relaxing signals such as nitric oxide. Walnuts bring unsaturated fats and polyphenol-like compounds into that environment, and the review found lower endothelial inflammation signals in some higher-risk subgroups, especially ICAM1 patterns. That does not prove walnuts prevent events by themselves. It suggests one plausible pathway: better vessel responsiveness in a healthier overall diet. Before we go further, nuts have a hard safety boundary: allergy. In children, food allergy can show up as rapid itching or tingling of the lips, tongue, palate, or mouth after foods including nuts, sometimes with swelling. Any history of nut allergy, anaphylaxis, or reproducible oral symptoms needs medical guidance. Whole nuts are also a choking hazard for young children. For infants, allergenic food introduction is a pediatric conversation, not a social media experiment.
So if someone is not allergic, what is the practical dose? People hear a handful, but hands vary. Are we trying to add nuts on top of everything? Or design a swap that is small enough to keep weight stable?
A useful anchor is around 30 grams a day, because recent post-myocardial infarction studies use 30 grams of mixed nuts, peanuts, cashews, and Brazil nuts. That is roughly a small handful, not a cereal bowl. In those trials, adding nuts to an already cardioprotective diet did not significantly improve inflammatory biomarkers or adipokines over 16 weeks. That is not failure. It tells us the effect may be smaller when the base diet is already being improved.
That is an important limitation. If a person already eats a high-quality diet, nuts may not move every marker. Who is most likely to notice a meaningful benefit? Someone replacing refined snacks, someone with cardiovascular risk, or someone chasing general longevity?
The best fit user is someone whose current snack pattern is refined starch, sweets, or saturated fat-heavy foods, and who can use a measured nut portion instead. People with cardiovascular risk may also be interested because the Walnut review found endothelial signals, and exploratory work in Australian adults linked higher nut intake with about 1.13 millimeters of mercury, lower systolic pressure, partly mediated by lipid metabolites. But that study was small and cross-sectional, so it is hypothesis-generating. Product choice can erase the advantage. Salted, candied, chocolate-coated, or oil-fried nuts are different from plain nuts. Use the nutrition facts label for serving size, sodium, added sugars, and calories per serving. People with chronic kidney disease or mineral restrictions should ask their clinician or renal dietitian before making nuts a daily habit, because potassium, phosphorus, and portion size can matter. This is food, but it is still a concentrated food.
What about weight? The intuitive fear is that adding a dense handful every day slowly becomes extra body fat. Does the evidence say nuts prevent weight gain, or just that they are less fattening than their calorie count makes people expect?
I would phrase it as less predictable weight gain than the calories imply. Not nuts melt fat. Protein, fiber, chewing time, and incomplete fat release can increase fullness. But acute satiety evidence is not uniformly impressive. A crossover trial of a high-protein beverage made from cashew byproducts found no significant satiety or later energy intake difference compared with whey or cow's milk controls. So judge nuts by your pattern: hunger, snack replacement, weight trend, and cardiometabolic markers. One more boundary: do not turn observational disease associations into prescriptions. A 2026 dose-response meta-analysis of prospective cohorts found legumes and nuts were associated with lower Parkinson's disease risk, with an odds ratio around 0.71 for high versus low intake. That is interesting, but it is not proof that nuts prevent Parkinson's. Diet pattern, confounding, and combined legume plus nut categories matter. Use that as supportive context for healthy eating, not a treatment claim. My practical ladder is simple. First, choose plain nuts or minimally salted versions. Second, portion them before eating. About 30 grams is a useful anchor. Third, make them replace something less useful, not decorate an already full day. Fourth, set realistic outcomes. Better diet quality, improved fat profile, possibly better endothelial function, and maybe small blood pressure changes over weeks to months. If weight rises, sodium rises, allergy symptoms appear, or kidney limits apply, the plan changes.